All right. Good afternoon, students, families, and supporters. My name is Valerie, and I work with the New Student and Transition Programs Office. We are so glad you are joining us for today's session on health and wellness at SBU. During this session, we have representation from Student Health Services, the Center for Prevention and Outreach, also known as CPO, and Counseling and Psychological Services, also known as CAPS. To start off this session, we will hear a little bit from each of our panelists. From there, we will open the floor for your questions. We also have our peer assistant leader, Katie, here today, who can answer any questions you have in the chat as we go through our presentation today. This session is being recorded, and access to the recording will be available on the same page that you logged into. Feel free to submit your questions throughout the session, and we will get to answer as many questions as we can. We will also have time for our panelists to answer questions at the end of the session. I would now like to introduce Karen Dibas from Student Health Services.
Thank you, Valerie. Let me just screen share. Okay, so Student Health Services is your healthcare away from home. We are located on the campus near the stadium, and we are open 5 days a week, Monday through Friday. Let me go to my next slide. We are a mixed group of dedicated healthcare providers. We have physicians, we have a nurse practitioner, some physician assistants, medical assistants, our registered nurses, and a few LPNs, a medical technologist, pharmacist, as well as a dietitian and nutritionist who comes onto campus part-time twice a week to work with our population. Our mission is to provide accessible, high quality, cost-effective primary healthcare to a very diverse student population. And I think that our providers do a really great job of providing that for our students. We have a lot of services that we offer. We do highly recommend that someone makes an appointment as opposed to walking in. Although now that COVID numbers have decreased, we are seeing some limited numbers of walk-in. But in order to make it a little bit more certain or guarantee that you have an appointment, we do recommend calling ahead. Our medical services include things like primary care, preventative care, as well as travel medicine. So many of our students who are traveling, say, to Madagascar to do some school-related work may come to see us to find out what vaccinations they need, what preventative things that they should do. And that's one of the enjoyable things that our practitioners work on. We also have sexual health services, really all gender sexual health and HIV risk reduction offerings as well. We have an immunization clinic, which actually you can self-schedule for through the Wolfie Health portal. We'll talk about that in a moment. But we give routine vaccines, the flu vaccination in the fall when it's, in particular now when it's flu season, and also offer COVID-19 boosters. We have ancillary services here right in our center, which includes the pharmacy. So if any of our practitioners write a prescription for either a prescription medication or recommend that you take some kind of an over-the-counter medication, you can actually get that right here in-house as long as your health insurance covers it here. Alternatively, if that's not possible, we can also electronically prescribe to an outside pharmacy as well. We also have a laboratory here that offers laboratory services. They do some labs in-house, and some of the labs we send out to, again, local laboratory services, and we try and match that with whatever your insurance is. Chrissy Tobar, who's our nurse manager, is behind me. So hello. Type in if there's anything I'm missing here. And the other thing that we have done, although we don't have it formally open the way we have always had in the past, is our self-care clinic. So if you are sitting in your dorm room or in your class and you realize, oh, you know, I'm feeling a little sniffly today, I could really, or I have an allergy, I could use an allergy medication, you can come into our pharmacy and, you know, request certain kinds of medications that are over the counter, limited number at a time per semester, and they will fill that for you at no charge or minimal charge. And again, I mentioned the dietitian or nutrition services. We also have one morning a week, a dermatology clinic that is a senior resident from the dermatology service over at the hospital comes to see our students for us. It's by appointment only, and it is by referral from one of our healthcare practitioners. So you would need to be seen in the clinic first, and if they felt it was something that they could not handle, or it's been, resistant to the kinds of treatments that they're doing, or if it's something of concern, they will refer you to that dermatology clinic. It's a nice offering here. I mentioned the Wolfie Health Portal, and this is really important. We are here to help you, but in order for us to help you, you also need to help us in that care. So it's a partnership. The Wolfie Health Portal is located on our webpage, and we'll give you information on that in a moment. But it's where you can make appointments for immunizations. It's where you can make appointments for the lab. It's also where you would update your insurance information and also upload any things that we need, such as your immunization records, which is a New York state law that we have to have certain immunization records on you. The other thing that's important is to opt into texting. That's not automatically done. And if you opt into texting, that allows us and our practitioners to reach out to you and to send you secure messages through the portal, and you'll get a text message letting you know that there's a notification there. It's much easier, and sometimes if we are relying strictly on a notification through email, it gets lost in spam. So we really press it upon our students to opt into texting. You may never need it, but it's there if you do. Appointment reminders. And appointment reminders as well come through the text. I mentioned insurance. It's important to keep your insurance up to date. Some students switch insurances frequently, and it's so important for us to know, again, where to send your prescription, where to send your labs. So if you know your insurance has changed, or if you're just not sure, go into the portal, check, and put the proper information in there. The other thing is that we talked about immunizations. If you go into the immunization portion, it will let you know if you're compliant or not compliant. And if you are not compliant and you're not sure what you're missing, you can always email us at vaccinations, vaccinations at stonybrook.edu, and we can let you know what you're missing. So we have many of the questions that students have can be answered just by looking at our robust website. So I encourage you to look at it, look at the things that we have just discussed, look at other offerings. And this is the phone number for calling us, 631-632-6740. And this is the QR code that will bring you to our website directly. We thank you for your time, and we look forward to taking care of you. We never wish upon anybody to have to come to Student Health Services, but if you do, we're ready, willing, and able to help you out. Thank you.
Thank you so much, Karen. If anyone has any specific questions for Student Health Services, feel free to throw them in through the Q&A section right now. If not, we will move on to the Center for Prevention and Outreach. So I would now like to invite Christine Zaras from the CPO to speak to you all.
Hi, everybody. It is a pleasure to be with you. I'm just pulling up my slides, and I want to apologize for not having my camera on. My camera doesn't seem to be working, so rolling with the tech difficulties. I think everybody is able to see our slides. And I want to say hi to Karen. Already got a chance to say hi to Judy, who you'll hear from next. But these are dear colleagues. It's always wonderful to have a chance to talk with them. And also it's great to be able to present with them, to be able to talk about how all the things that we do in our individual offices kind of go together. So when we're talking about CPO, the Center for Prevention and Outreach, we're talking about early intervention and prevention education. So a lot of the stuff that Karen was talking about in terms of the treatment, part of where we're coming with CPO is to kind of help people recognize, what's happening with their health in different dimensions, be able to take care of themselves in different ways, hopefully head off the need for treatment or more extensive care in some cases, but to also be able to connect with folks who are very knowledgeable about different resources around campus so that when you do need some support, you're feeling like we're all kind of working together for you. We have 4 main topic areas that we focus on at CPO. The first is alcohol and other drugs. We also focus on mental health and suicide prevention, physical health and wellness, and violence intervention, prevention, and relationship education. So our goal with each of these areas is to help students understand a little bit more about how these things are operating in their lives, in the lives of people around them, and kind of making knowledgeable, informed choices about different things to make sure that they stay healthy or they can get healthy if they're running into trouble with their health. When it comes to each of these topics, we approach our efforts in a variety of ways. For example, if I'm going to be providing the CPO website before we wrap up, on the CPO website or on the Campus SB Engage site, what you'll see is tons and tons of workshops and trainings where you could learn more about all of these topics. So for example, on the alcohol and other drug side, we've been hearing lots over the last few years about the increase in opioid use and the dangers of overdose. You can learn how to administer Narcan as part of one of our trainings, so that if somebody in your kind of vicinity experiences an accidental overdose, you might be the person who's able to save their life. By the same token, you're going to hear a little bit more about our bystander trainings for all of these areas that help you focus on other kinds of skills that can help you just step in and make a difference. And while some of the stuff I'm highlighting right now sounds pretty serious, we also do a whole range of kind of meaningful, fun activities. What I mean by that is they're fun things to do, like our healing arts events, where we use creative activities like crafts or DIY spa things, stuff like that, to help people learn more about self-care and coping and find creative ways to take care of themselves. So we try to balance out some of the kind of heavier, more serious stuff that we're talking about with maybe a little bit lighter ways to approach those same subjects. And in addition to the things I'm already highlighting, we cover each of these areas through different kinds of health screenings. So throughout the semester, we do health and wellness fairs. We are offering screening days. We also have community providers come into the CPO office, and people could come here if they want to get tested, say, for sexually transmitted infections, if they want to kind of get a sense what's happening with their vision or their blood pressure. We collaborate with folks all over campus to help you learn more about what's happening with your health and ways that you can maintain or improve what's going on. Another big area that we want to make sure that students know about is all the free health products that we have available. So we're talking about things like menstrual hygiene, we're talking about safer sex supplies, first aid kits, cold and flu kits, and this is definitely the time to be thinking about that stuff. Using this QR code or going to our website, students can request a specific number of items, or you can always just pop by the office. We always keep some supplies around, and you can see here that at different locations around campus, we partner with different departments like our Friends in Recreation and Wellness or the LGBTQ Center and even the Commuter Student Lounge to be sure that some of these supplies are available for folks, even if they don't make a special request. But we want you to know that these things are here for you. We know everybody's in a different place with money, and we don't, just like my colleagues in other areas, we don't want you to let money get in the way of taking care of yourself. So this is something we're really happy to offer to folks. And as I mentioned before, we have a variety of trainings to help people learn how to kind of not only gain valuable skills to recognize when there might be a problem, but to do something about it. So around the alcohol and other drug prevention side of things, we're looking to prevent overdose, whether from alcohol or from other drugs. And that's what our Red Watch Band program is about. Our QPR program stands for Question, Persuade, Refer. And this is a program aimed at helping people recognize the signs of potential suicidality and kind of get a little bit comfortable with kind of letting people know they're concerned, or kind of letting people know what kind of resources are out there if they are concerned. And the area, this is near and dear to my heart because this is the one that I focus on, is interpersonal violence prevention. And that's what our Green Dot bystander intervention training is all about. Recognizing signs that maybe somebody's experiencing something they don't want to experience, or even the signs that somebody's already experienced violence, and learn what they can do to make a difference and to support the people in their community. So each of these individual trainings offers students a specific certificate, but students who complete all three of these trainings get a really special recognition at Stony Brook. You get what's called the Upstander Award, which includes not only a special certificate and an invitation to an annual gala on campus where we recognize our upstanders, but you also get a special cord to wear for graduation. And this is a big deal, as whether you're a transfer student or a new student, you've got your eyes on graduation as soon as you get here, for like many students. And we want you to know there's lots of things that you can do to distinguish yourself, both within the academic arena and then beyond the academic arena in the areas that we all work with. Beyond our trainings, we also want you to know about some of the resources available through CPO. The most important one that I think is worth highlighting right off the bat is our survivor advocate and prevention specialist. As I was saying, interpersonal violence prevention is something we take very seriously. We offer a lot of opportunities to learn more and to understand the resources. But we also want you to kind of know where people can go if they experience something and they just don't know what their options are. And that's what the Survivor Advocate is all about. So in this semester, I'm actually serving in that role because our primary advocate is on maternity leave, but by the time you're here for spring, she'll actually be back early in February. And what the Survivor Advocate can offer is a confidential place where you can learn more about your options and have somebody who can help you navigate those options, right? Connect with both on and off campus resources, somebody who can assist you with going for a forensic exam if you've experienced assaults within the last 5 days or 120 hours. And these are not things that folks are typically thinking about or want to think about, but they are important things that if you find yourself or someone that you care about in a position of needing support around these issues, we don't want you to have to scramble to figure out, well, where am I supposed to go now? We want you to know right up front, that's something that's here for you. I'm somebody who's here for you, just like my colleagues are here for you if you experience any of these things. This phone number that's up on the slide, you could make a note of that, but all of these resources are going to be available to you on the CPO website. And you can access the advocate just by calling this number. Someone will always pick up Monday through Friday, 9 a.m. to 5 p.m. A staff person, like I said, me or my colleague will be answering this phone. After 5 p.m. or on the weekends, we have an after-hours service that supports us. So there's never a time where a student will call this phone and not get someone to support them. And in cases of emergencies, that after-hours person would ring through to me or the other person covering the advocate line. I know I just threw a good amount of information at you, and some of what we're kind of talking about, you might be saying, well, this isn't something that I'm dealing with in my life, or I kind of anticipate having challenges with in my life, but I want to be there to help other people who may. And that's another whole side to CPO. We have a very robust peer education internship program, which means that students can earn academic credit for supporting the health and wellness of their peers. So as a peer educator with CPO, you learn how to educate, empower, and connect with your peers. That's our whole buzzword, right? Educate, empower, connect, because that's what it's all about. And we help you help the students that you know in your life. And often these are also transferable skills. Learning how to help your peers here at Stony Brook can help you learn how to help a lot of people in a lot of different settings. As I mentioned, we do a lot of fun stuff for the community, but we also do a lot of fun stuff for our peer educators, right? It's the team building stuff like self-care spa days or craft nights. We start recruiting right away in January. So if you are interested, you can always feel free to reach out to me directly, but you also want to keep your eyes on our SB Engaged and our website. Everything that, we have to offer in terms of education, workshops, trainings, fun events, large scale awareness events like our Walk of Hope for Suicide Prevention or a Take a Stand Walk with Me Domestic Violence Awareness March. Any of this stuff is going to be up on SB Engage, and it's also going to be on our social media. So whether you want to attend an event or you want to learn how to be one of the people hosting the events and helping us out as a peer educator, don't be shy. As I mentioned, we start recruiting fairly early. You can get online, you can tell us you're interested, and we'll be reaching out with more information. That's all I have for you folks, but I'm going to be here if you have any questions. Thanks very much.
Thank you so much, Christine. Once again, if anyone has any specific questions for CPO, feel free to throw them in the chat right now, and we will have time at the end of our session for more questions. With that, I'd like to introduce Judy Esposito from CAPS.
Hi, thank you, Valerie. So I'm Judy Esposito. I'm the Associate Director here at Counseling and Psychological Services, also known as CAPS. I love the way that Karen and Christine have already made it so clear how the three of our areas come together and work so closely. There's such a synergy in everything that we do. And so I will just kind of round this out by talking a little bit about CAPS. So CAPS is basically our mental health center here on campus. We are in the Student Counseling and Health Center building, which is upstairs from the Student Health Services. So we're pretty easy to find. We're right by the stadium. And again, we're on the second floor. We are open Monday through Friday, 8:30 to 5. Once the new semester starts. Right now, we're in our intercession hours. We are providing all kinds of mental health services in terms of individual work, group work, workshops. We have psychiatry on staff if there are students that would benefit from some medication management. We have a really devoted and committed multidisciplinary team here. We have licensed mental health counselors here. We have licensed clinical social workers, psychologists, psychiatry on staff. And we all work really closely together to provide what we hope is just the best kind of services for our students. Our work is in person. We do also offer Zoom, but we find that most of our students are really wanting some in-person services. But again, if something more remote is something that would be more comfortable for you, that is definitely something that we can provide as well. You would just need to make sure that we know. So simply just tell us that you're looking for something that is either in person or remote. We can accommodate either one. We also offer, like I said, our hours are 8:30 to 5, but you can speak to a counselor 24/7. Every day of the week, 2 o'clock in the morning, feeling overwhelmed, whatever the case is, you can call the main CAPS number, which will be available on our website. I think that Katie will also be posting those phone numbers for us. Or you can call the CAPS After Hours line directly, which is also an 800 number, also on our website. And you can speak to a counselor 24/7. And I think that that is so valuable. Sometimes it might be hard to make that first step to come to CAPS. And if it is, then maybe it helps to just kind of test the waters a little bit and give a call to the After Hours line. Know that there is always someone to talk to. There's always someone who is available to hear you and be present with you and understand what's going on for you and offer some guidance and suggestions and other ways to access services, because you don't have to keep feeling the way that you're feeling. If you do want to then just come to CAPS, there's a few different ways to do that. One is through the Wolfie Health Portal, which Karen mentioned is one of the ways to access all of your medical services. It's also a way to access scheduling an initial consult for us here at CAPS. So you would just go on your Wolfie Health Portal and you'll see that there is a calendar for scheduling an appointment. And it's easy as just clicking the appointment time that you want. And that will prompt for you to get your appointment scheduled. There's a little bit of paperwork that you would need to do. And if for some reason you go on, appointments do get scheduled pretty quickly, then all you need to do is call us. If you don't see an available appointment, I don't want you to worry about that. I don't want you to think, oh, there's no appointments, forget it. I want you to just give us a call. It is really that simple, and we will then accommodate what you need in terms of an appointment time. If, however, what you're looking for is an appointment time, let's say at night or on the weekends because you have a busy schedule and maybe you work, those aren't necessarily times that we're going to be able to accommodate, but we have Timely Care here on campus. And I'm not sure if you know what that is, but Timely Care is kind of an extension of us. And it allows for our students to access remote mental health services at your fingertips. There will be, the information about Timely Care is also accessible to you on our website. And it's as simple as downloading an app, and you get to go on, and you can even kind of choose your therapist. If there's, someone that you are thinking has maybe a specific specialty that you think you want, you'd be able to do a little bit more of that sort of a la carte shopping through Timely Care. Both our services here at CAPS, as well as Timely Care, is of no additional charge to you. Students pay a student health fee, and that's how these services are available to you. So it's not like there's a copay or anything like that. We do sometimes have students that really feel that they want something a little bit different. Maybe coming to CAPS for whatever reason isn't convenient, or maybe you don't want something remote and you do want to be seen in person, but you feel like maybe you would be better served working with someone in the community. We can absolutely make those arrangements for you and work with you and your insurance to get whatever services you need. We have clinical care managers here on campus at our center, and they would do all the work to try and locate those services for you. Often we have students who maybe they're going home for the summer and they're in another state. And we can help you to find a clinician, find a therapist, find a psychiatrist, whatever it is that you're needing in your home state. And those are also services that we can offer for you. What else do we have that you guys should know about? One of the really popular things, and we work pretty closely and often with CPO for this, is our CAPS PALS program. So our CAPS PALS program is an animal assisted intervention program. And what that really means is that we bring dogs to campus and we have events. One of the best ones that we do is with CPO. It's the Healing Arts program. And we have dogs there. And we find that that really provides an opportunity for our students and sometimes our staff to just have a minute to catch your breath and relax. And what it stands for is Pet Away Life Stress. And sometimes that really is a very helpful thing. And our counselors are there, so you can always ask questions, find out more information about our services, and maybe make that step from, not being really sure if you want to access CAPS services to actually making the step and giving us a call or going on the portal and scheduling an initial consult. So we are here for you. And if you have any questions, please feel free. If you have questions later on, know that you can just give us a call and we would gladly answer any and provide any information that we can for you.
Thank you so much, Judy. All right, at this time, I'd love to open up the floor for any questions that any attendees have. I'll ask my friend Katie, our peer assistant leader, to kind of get the ball rolling here.
Yeah, so as a campus in which a lot of our students are very interested in the health field, from psychology and getting involved with counseling to being involved with like pre-med, pre-health in general, how can students not only come to you, but get involved in your different offices?
I'll dive in real quick, only because I think it's the most direct path. As I mentioned before, we have a peer education program where students can earn internship credit. And this is relevant because all students at Stony Brook have to earn a certain number of what are called EXT, experiential kind of credits, and our internship will satisfy those credits. So students who are interested in working in any number of health professions can check out CPO's peer education internship opportunities. We work with students who, some aren't actually even going for the helping professions, but they want to round out their sort of education with another kind of experience. So for example, I've worked with, engineering students, I've worked with business students, and sometimes it's just a little bit of a personal passion getting involved in this kind of work. But primarily, we deal with a lot of students who are pursuing nursing, health sciences, social work, psychology, even students who are interested in, say, political science or women's and gender studies, people who are interested in the intersections between different areas of health and different areas of, the world or our lives. And so for students who are interested in maybe kind of dipping a toe in sort of helping kind of work and getting the opportunity to connect with a lot of different professionals from different training backgrounds, whether, again, some of the stuff you've already heard about, medical kind of oriented professions, public health, mental health, right? That's part of my training. People are interested in learning more about assessment, right? Because that's a big part of what we do, is using data to guide our interventions in the work we do. All of these folks would be really, really a good fit for working with CPO. And so that's one path to get in the door. And honestly, that also gives you the opportunity to connect with colleagues in all of our health and wellness areas, because we have great relationships. Our interns, for example, sit on the Student Health Advisory Committee, which is also known as SHAC. And that's where you'll see professional and student representatives from some of our other departments like student health and CAPS. So that's one very direct path that students can take to get involved in the kind of work that we do and gain a little bit of experience that could be quite relevant for your resume as you're thinking about what's going to come next.
All right, well, if we have no other questions, thank you again, Christine, for answering that question. And thank you to Karen, Christine, and Judy for being here with us today. And thank you for joining this session. If you want to go back and watch this session, it will be available soon on our YouTube page. But I believe that's all we have for today. So thank you for attending once again, and have a wonderful afternoon.